Hi, everyone. Thanks so much for joining us for Ask the Expert North Texas. I'm Kristen Diaz.
I'm David Rankin. Today we get news. LeBron James' son Bronny collapsed during a basketball workout in California. He's in the ICU after a cardiac arrest. Plus, here at home, we're dealing with intense heat and we're about to add Egyptian dust to the skies to provide a dangerous combination to just about anyone, especially heart patients. On today's Ask the Expert, we're joined by Dr. Fahmi Farah. She's from Bentley Heart Health in Fort Worth. She is in the KRLD Zoom room. Dr. Farah, thank you so much for the time.
Thanks for having me.
Let's start with Bronny James. Now, I know you're not directly involved in this case, but when something like this happens to a young athlete, there always seems to be a condition that no one knew about beforehand. Is this a common thing, especially with athletes?
It's not a common thing, so to speak, but it does happen. It's not rare. And you're right. In athletes who are very high performing and all of a sudden can collapse and have a cardiac arrest, that's scary. A lot of times it is due to some kind of a heart condition. So checking up on your heart is so important.
We saw this with Damar Hamlin in the NFL, just about a year ago, when he collapsed on the field. What did we learn from instances like that of seeing these professional athletes in the moment, when we hear these things at the moment, when speculations start to arise?
We learned certainly a lot from that, Damar Hamlin situation. Although I think those are two different scenarios. In his case, he had a direct blow to the chest, so the cause was pretty clear. It was due to something called commotio cordis. When you get a direct blow to the chest, it can suddenly stop the heart and it can set it off to a dangerous rhythm. Arrhythmia, it's called ventricular tachycardia, and it can cause people to collapse and actually lose pulse and have a cardiac arrest. And in this situation, I don't think that's the case because I don't believe he had a direct blow to the chest. He was just practicing, and during the event, he just had a sudden cardiac arrest. So the likelihood of him having some kind of a cardiac condition is high in this situation. So only time will tell once they do the proper workup, the testing to figure out what exactly caused it. But Kristen, you asked a very important question. In the immediate setting, what do we do? And that's something we learned a lot from the previous scenario, both situations, like that immediate providing care in that immediate setting of cardiac arrest is everything. That's what saves life. So that's when we talk about CPR, providing timely CPR is life-saving during these situations. And that's what happened in both cases. I'm very happy to see that.
And of course, that just stresses the fact that CPR is something that everyone should learn. Both of these athletes had the ability with professionals around them at the time in order to help them at some point. But in a lot of cases, in the real world, we don't necessarily have medical professionals around us if we're having a heart issue. Talk again about the importance of learning CPR and how you can actually save lives.
Very, very important topic. CPR is so life-saving, and these two are just prominent examples right in front of us. If we had not been able to provide the CPR in a timely manner, the outcome would have been very different. It's two things we worry about. First of all, with cardiac arrest, the first thing is bringing this person back to life. And that is something we are capable of doing with CPR. The other thing is, even if they survive the cardiac arrest, the likelihood of them returning back to life without sustaining any brain damage. So that's the other component of providing CPR in a timely manner, is not just surviving, but also minimizing any kind of neurological deficit or damage done as a result of the lack of circulation. So the importance of timely CPR it's very much important. It cannot be stressed enough. And the second part I want to talk about is so important for everybody to learn CPR, especially those who are not medical professionals, because the majority of the times we're not in the presence of a medical professional. It's our family members and friends. And the good news is that anyone can train in CPR. It's available to everyone. You can go through, there are many different sources. American Heart Association is one of them.
No, absolutely. It's so critical that we not only know how to administer CPR, how and to also know where AEDs are, whether that be in our workplace or if we see it at the airport or at the mall or wherever we might be, to be aware of those things. You never know when you might actually need to grab one and use one. This is the time of year though that we really just need to focus on wellness overall. There are a lot of environmental factors that can be at risk to our heart, be a risk to our heart, especially like this heat that we've been dealing with. David, we've been talking a little bit about how this has been so hot every day on the show. We're starting off in triple digits, and it always gets hotter by the end of our show, being in the afternoon hours. Our listeners, need to make sure that they're safe.
This, of course, leads into a situation what we're dealing with right now with this extra heat. Plus, there's going to be extra pollution in the air as more Egyptian dust is coming into the air. Talk about that combination of the heat plus ozone action days that we're seeing, and some of them could be getting a little bit worse.
Absolutely. This is a very, very important topic, David. So thank you for bringing it up. We've known for a number of years that air pollution and heat extremes of any kind of weather can have an effect on your heart health. It can precipitate things like heart attack. For example, during extreme cold weathers and snow, people go snow shoveling and they get a heart attack. And same thing with extreme heat, we do see increased rate of heart attack. In fact, there was a study that just came out. It's a study that was done in China, and basically it has proven that yes, extreme heat can have an impact on rate of heart attack and your cardiovascular health, overall cardiovascular health, as well as pollution. The interesting thing it pointed out is that the duration of exposure actually matters. So they looked at 2-day duration when it came to exposure versus 4-day. And with a 2-day exposure, the risk of heart attack went up by, I believe it was like close to 20%, like 17%. But when that exposure time increased to 4 days, it went up to 74%. So it's remarkable. I mean, so my advice would be for everybody to, of course, avoid the heat, avoid your exposure time outdoors, especially with air pollution.
Now we know that we have our outdoor athletes are getting ready for the fall. There are still these summer camps that are happening up until school starts next month. Just advice for parents. We know that when they're in the care of coaches and, staff and administrators, they are, of course, keeping a close watch on our kids. But sometimes it's our parents need to be having those conversations with their kids as well about what symptoms you start to feel. When should you speak up that you're not feeling well? Should we get that physical done before school? Like those types of things that you advise parents to do.
Absolutely. A very important thing, again, topic, because it's not just cardiovascular disease that we're talking about. This with some of the common things we worry about in this kind of heat exposure, especially for children who are, playing sports or in summer camp. Things like heat stroke, things like dehydration, those are the main things that keep our hospitals and our emergency departments so busy during this time of the year. So avoiding prolonged exposure in this kind of heat is advisable for all age groups, including our children and, teenagers, athletes, all age groups, and staying hydrated. You really have to maintain that hydration, especially when you're outdoors, making sure you're adding some kind of an electrolyte drink to not deplete your electrolytes when you're sweating a lot. Some of the symptoms to watch out for really are the heat stroke symptoms. If you're getting excessively tired, extreme fatigue, difficulty breathing, you're feeling nauseated, dizzy spells, and you feel like you're about to faint. Those are all pretty ominous signs. Those would be the warning signs to get yourself out of the heat as quickly as possible, cool yourself down, and call for help.
Isn't there several different levels of heat stress that can cause issues for us? Obviously, heat stroke being the worst, but it's not just going from 0 to 10. It kind of builds, doesn't it?
It does build. You're right. So there's heat exhaustion that takes place before heat stroke. And some of the symptoms that I just mentioned, those are part of it. And to reiterate the point, the time it takes between heat exhaustion and heat stroke is actually not very long. So we don't have to be exposed outdoors for hours to get heat stroke. It can happen within minutes. So I just want people to understand, to not think that you have to be there for too long to get a heat stroke, not in this type of heat.
Dr. Fahmi Farah from Bentley Heart Health. Doctor, thank you so much for the time.
Thank you for having me. It was my pleasure.